If you're currently experiencing pelvic pain, pelvic floor dysfunction, CPPS, whether you're a man or a woman, you're most likely looking for answers like, why did all this start? Why am I still experiencing this? What is the root cause? So in this video, I want to talk about the primary root causes that can lead to pelvic floor dysfunction. Spoiler alert, it's not just one thing. It's usually a combination of different factors. And everyone's case is different. And I'm not here to dispense medical advice, but just to give you information from my particular experience and also from working with many men and women who have experienced pelvic floor dysfunction and also have been able to overcome it through our Overcome Pelvic Pain program. First, I want to give you a quick visual metaphor. Imagine yarn as your pelvic floor, and there's just some yarn and it's flowing and smooth and supple and everything is working well. And you're like, okay, I'm able to urinate, able to have sex, able to have a bowel movement, all these things, exercise, and it's pretty typical, right? But imagine this yarn getting tied up and knotted and kind of creating a ball of yarn. If you've seen a ball of yarn and you try to take it apart, it takes a while. So when it comes to something like pelvic floor dysfunction, CPPS, it's typically built up over a period of time, and it doesn't start to manifest symptomatically until it really gets tied up and entangled and enmeshed with hypertonic muscles, a high level of tightness, a variety of other symptoms that can appear whether you're a man or a woman. The first root cause that I'll share is body alignment. By the way, I'm not sharing these root causes in any particular order. When I say body alignment, I mean think about your posture. How do you stand? How are you sitting most of the day? How are you walking? Is there a particular sport or hobby or activity in which your body gets aligned in the same way over and over and over and over again? Considering this, how you sleep. And what can happen is that perhaps maybe if you've been sitting down at a desk, working hunched over, or kind of shifting your weight a certain way, maybe because of an injury, or tight hamstrings, or you haven't been stretching out, or because again, you're overtraining something, what will happen is your body will attempt to overcompensate in one area to keep your body out of pain. And this can create things like a pelvic tilt, or it could create some sort of imbalance or misalignment in your spine. And all this can have a ripple effect down on potentially creating a pelvic floor tightness because you're overusing certain muscles, underusing certain muscles, and that's one potential thing that can lead to CPPS. Another root cause could be overtaxing your pelvic floor muscles. So whenever you orgasm, for example, you have involuntary muscle contractions that take place. So having sex a lot, or also potentially doing a lot of Kegels, or practicing edging, things like that. Men and women can do these practices to attempt to strengthen themselves and to build endurance in different things. But there's a possibility of overdoing it and overtaxing these muscles in different types of activities. That's something else to take into consideration. Another possible root cause is improper nutrition. And again, keep in mind that many of these can work together to create a ball of yarn. Improper nutrition meaning considering bio-individuality, because we are all different. So you might be eating a diet that your spouse or that your family is eating, and it might not suit you as well. But whenever we're eating certain foods that are not reacting well to our gut and to our own individualized body, we can have tightness created. We can have inflammation in our gut, in our digestive tract, in our stomach. And this inflammation can create a tightness and a pull on your pelvic floor, because your core and your pelvic floor are intimately connected and right next to one another. So this is very important. You also could be constipated often. Things that are out of whack, out of balance in your digestion, in your diet, can absolutely create a compounding effect. And maybe you already had a body misalignment. Maybe you had one of these other root causes. It's one aspect that creates that ball of yarn that must be considered as a root cause. Another possible root cause is a direct injury, perhaps falling onto your perineum, pulling a muscle in your pelvic floor, something where you're like, wow, this happened, a specific direct injury that is also leading to these potential symptoms that I'm experiencing. Interestingly enough, this is typically one of the rarest things that we see in our work, at Vibrant Pelvic Health whenever it comes to people who have pelvic floor dysfunction symptoms. Doesn't mean it doesn't happen, of course it does, but it is something to take into consideration. And for the last area of root causes, these are related to the mind-body connection. By the way, these are really, really important to pay attention to. Really important. So first, let's talk about is stress. If you're stressed, well, we all experience it, but whenever you're experiencing stress too often, the sympathetic nervous system is activated. And what happens is that your body is not in a place for rest and repair and restoration. It's in a place of, we need to have all hands on deck. We need to fight, or we need to flee. We need to hide. There's something going on that we're basically not okay with right now. And stress has benefit, right? It has allowed us to survive and thrive and evolve as a race, you could say, over time. But we must be aware of this, and it can create tightness. It can create inflammation. It can put your body just in a state of dis-ease and disorder overall. And to continue on, let's talk about fear, control, and anxiety. Something quite similar to stress, but also a little bit different. The pelvic floor muscles are emotional muscles. We store our emotions there, very much like we do for our upper body and our shoulders. We do the same for our pelvic floor and our lower body. And if you take a look at the thoughts and the emotions that you've been thinking and cyclically recreating emotionally within your body as energy and motion over and over and over again. And if you also think back to whenever all this started, or also prior to whenever you started to feel the symptoms, because remember, the ball of yarn took a while to be created. You might notice things like fear, being afraid of something that's happening, being afraid of the external environment, changes, transitions. Also on that same line is control. Trying to control our situation, trying to control the outcomes, and having anxiety because we're wanting to control the future. And we're trying to figure everything out. And we're afraid of something not working out exactly how it should. So having a huge amount of attention on the past or the future, instead of just being in the present moment, will absolutely create a major imbalance in the root of your body and your pelvic floor muscles. And this can compound and connect and combine with the other root causes to create this overarching situation. So I'm not just going to leave you hanging like that. Let's talk about how to untangle the ball of yarn. So in Vibrant Pelvic Health, Dr. Bree and I worked together and we created Overcome Pelvic Pain, which is a fully guided 12-week program so that you can be guided on this path and follow in the footsteps of myself and others who have done it and have gotten their life back and are living in vibrancy again, which is what I want for you. Now, we have 4 pillars. The first is body awareness. This is really important because if you don't know what's happening within you, most people are like, I don't even know where my pelvic floor is. Like, what are you even talking about? You need to know your pelvic floor muscles. You need to know how they feel. You need to be aware of when they feel tight. You need to be aware of these things. So we learn more about our body. And the next major pillar is movement. Movement, but mindful movement and movement that's specifically designed to help untangle the ball of yarn, open up, relax, release. We have specific routines that change and build over time that were scientifically formulated for this. And then the next pillar is nutrition, because we need to realize that which we're consuming that could be creating more inflammation and be getting in the way of our body's rest and repair. And then the last major pillar, which is very special and unique in our programs, is the mind-body pillar, the mind-body practices. We include meditations and mind workshops. What we're really doing is because when you consider chronic pain is the wiring and firing of the same neural networks over and over and over again. You're just creating a rut. You keep going down that same path. Even if consciously you're not saying, I want to be in pain right now. That's not what's happening. At the subconscious level, it's being reverted back to because of dangers in your environment. Someone says something. There's something outside of you. You have these experiences, and then your brain creates the pain response. So with the mind-body practices, not only do we We aren't just, let's relax and release. And we do have some of those meditations. We want to be in a place of relaxation more often, in a place of joy. But we do mind workshops. The mind workshops help us to reprogram, do a neurological, subconscious reprogramming, which is absolutely necessary, so that you're not just doing things at the surface level. We're not just stretching out our muscles and changing what we eat. We need to change how we're thinking, what we're thinking, and how we're feeling, because those were a major contributor to the pelvic floor dysfunction that you have been experiencing to this point. So we'd love to see you in the Overcome Pelvic Pain program. If you have any other questions, feel free to leave a comment below, and have an amazing rest of your day. If you are experiencing pelvic floor pain and are ready to put this in your past, make a firm decision and begin your healing today.